In March 2016, the medical center Nairi, jointly with Finnish orthopedic clinic Coxa, has founded Coxa Nairi Clinic in order to implement the world's achievements in the field of joint replacement. About 1/3 of the world population suffers from various dysfunction of the locomotor system. The joint disease holding the leading place among these pathologies and often lead to the development of disability. Jointly with leading specialists of Finnish Coxa Clinic, the hip and knee joint replacement surgeries and the revision joint replacements were performed. The revision is a surgery of reimplantation of an early implanted prosthetic joint that get degraded or complicated joints. Such kind of surgeries for the first time in Armenia was performed in Armenian Finnish Coxa Nairi Clinic. Despite same with the Finnish clinic high quality and level of intervention, it is much more accessible for the patients in the terms of cost and comfort. Total joint replacement is the surgery on the replacement of the joint components with implants, which have an anatomical shape of a healthy joint and allow performing all movements. The purpose of joint replacement is a reduction of pain and functional recovery of joint. Joint replacement is an effective and sometimes the only way of the functional recovery of the joint, allowing significantly improve the quality of life. After such kind of surgeries, the patient forgets about the pain in joints and returns to an active life. For joint replacement surgery in Coxa Nairi Clinic, the prosthetics of the leading companies manufacturers of implants are used. Each implant undergoes multi-level control and has a certification. The materials of endoprosthetics are characterized by high durability and good viability. Thus, the service period is about 15 to 20 years. In some cases, the patients may use them up to 30 years. Metal endoprosthetics are made from various stainless steel alloys. The surgery of joint replacement is applied in various diseases and joint traumas, which lead to a partial or complete loss of motor functions. Degenerative dystrophic disease, all kinds of osteoarthritis and arthritis, Bertram's disease accompanied by joint destruction, quiet hip disease, intra-articular fractures, dysplasia of the hip fracture. The Nairi Coxa Clinic was created in Armenia in March 2016. Up to now have been performed knee and hip joint replacement and 2 patients have already been carried out secondary or revision joint replacements. All patients on the first day after surgery were able to stand and walk. On the second day after the surgery, our rehabilitologists helped patients to climb and come down the stairs. On the third or fourth day, the patients discharged home. All our patients who were operated in Nairi Coxa Clinic are under the dynamic observation of the doctors during all follow-up period, and on 6th or 8th week can walk without crutches and return to their usual normal lifestyle. In Nairi Coxa Clinic is used European methodology, which includes intrasurgical local anesthesia. It allows to put the patient on his feet after 1 or 2 hours after the surgery and help to walk.
So we treat patients with end-stage arthritis, whether it's osteoarthritis, rheumatoid arthritis, post-traumatic arthritis, with maybe joint deformities, limitations in activities of daily living. Mostly the most important reason for operation is, of course, pain. Okay, let's take for example a knee replacement. We normally do it without tourniquet to reduce the postoperative pain, and most of the patients can walk within a couple of hours of the operation and will be discharged from hospital maybe 2-3 days after operation, and they achieve their previous state of activities within a couple of months normally, or they will be able to return to their work, and the long-term results are very promising. Nowadays, after knee replacements, we really don't end up having to do a revision surgery because of wear of the implants. And after hip replacements, the recovery is even more quickly. It's very important that if you had a hip replacement, for example, around 10-15 years ago, that you seek control visit with an experienced orthopedic surgeon, because there are symptomatic problems inherent with these old implants. After the wear of the
Nairi Coxa clinical has.
On the next day, the patient don't feel acute postoperative pain. Some hours ago, we have just finished knee joint replacement, and with the help of our physiotherapist, the patient will be able to walk after a few hours. The patient came to Nairi Coxa clinic with knee joint pain, deformation and difficulty in walking. This time we have performed the right knee joint replacement. Due to European latest methodology, the patient has an opportunity to have a surgery for the second joint. Left knee joint replacement not after 6 months but 2 months later after the first surgery. Today operated patient will climb the stairs. Tomorrow he is going to be discharged from the hospital.